Okay. Okay. Thank you all for having us. Thanks everybody. I was trying to find a good picture so you guys could see who I was. You know, I'm taking advantage of leisure wear. So sorry guys, I'm not going to turn on my camera. You'll see my Community Connections logo. I'm still looking for a picture that doesn't look like a mug shot. And I'm a couple years younger and a couple pounds lighter. So until I find that picture, I am not going to turn on my camera unless it is accidentally, as we do sometimes.
Well, Tom,
Okay.
you're
So
still showing the other.
Is it not, it didn't go into.
Yeah, you're not completely in presentation mode.
I click presentation, what's going on?
Go down to the bottom and click one.
Okay, you know what? I'm gonna take off. I have 3 monitors going and it's not, it popped on my other monitor. So let me. Did it go?
Yep.
Yeah, okay. Yeah, I don't know why sometimes my 3 monitors will do what I want and sometimes it will not. So everyone, again, I'm LaTanya Wright. Thank you for having us on the agenda today. Thank you, JCDS. For KDADS, I also have my colleagues, Russell Bowles and colleague Warwick on the call, and then I will let them do their own introductions. But I know people always ask us, what do you do at KDADS? How are you involved in Final Rule? So I'll let us do those introductions today. So again, I am LaTanya Wright. I am the HCBS project manager for KDADS. I consider myself, if you are familiar with Brutus Chagan and Michelle Hayden, I just call myself the assistants when people ask me, like, where are you at? I do a lot of the background work, so a lot of things that get done. I keep the projects moving, plugging in the gaps and what needs to be done. And also Brutus Chagan is my supervisor. He is the policy and contract manager. And then, of course, Michelle Hayden is the HCBS director. And then I'll turn it over to Russell and Colin to do their introductions. Oh, I forgot Final Rule, which is why we're here. Excuse me. Final Rule, I work on, I am over the lead on communications, outreach, guidance, and training. So that's where I come in. So as the CDDOs and other entities we contract with, if they need some more help to help you guys being that liaison with the providers, they contact me and I put it together and make people like Colin and Russell come along with me. So Russell, you want to do your introductions?
Sure. My name is Russell Bowles. For this particular portion, I am the Final Rule Desk Review Director. My role is anything from assessment to compliance other than heightened scrutiny would come through my team. So as far as desk review and the remediation process, that is where I'm in. And then I work alongside Colin Rourke, who handles anything heightened scrutiny. Thank you.
Yep, and good afternoon. This is Colin Rourke, and for KDADS, I'm the Program Integrity Manager for the Program Integrity and Compliance Unit. And for the purposes of the Final Rule, I'm the lead on the heightened scrutiny team. So one of the things, and we'll get to some more information on that, but that we want to get out there is that the heightened scrutiny process is just beginning. So no one has been missed or nothing like that. More communication is going to be forthcoming, but just wanted to open up with that we are just starting with the heightened scrutiny process. So a lot more information and guidance will be forthcoming. Thank you.
Okay. Thank you, Colin and Russell. Again, we want to thank you guys for having us on the agenda today. And then first, we're going to go through this short presentation, hopefully give you guys some more points of guidance. And then save your questions, please, please, please. As we're going through the presentation, if you have questions that come up, please write them down so you can be prepared at the end. We also got, Mandy had sent over those questions. Mandy and Jeremy had sent over the questions that some of you had already sent in that I got over to Russell and Colin, because Russell's over the desk review and remediation, and then again, Colin is over the heightened scrutiny. So we're here to respond to those questions and whatever questions you may have. So please, please, please be prepared to answer those questions at the end. And then after the presentation, I'll send the PowerPoint over to Mandy and she'll be able to get out to the group, okay? And we'll go ahead and get started. Okay, so today we're going to go back. We see a lot of things. We're getting a lot of the same questions or concerns from providers. So that's why we're here. You can talk directly with KDAD. Some things that we've noticed that we're going to do some quick recaps on, like what is the final rule? Why are we doing this? We hear at KDAD's, why are you bothering me? And so we're going to just do a short, quick recap of that. You'll have the presentation to look back at it. And then what? Kansas, what are we doing? Why are we doing this? We'll go back over that. And then some tapping in on some trends and some questions on final rule implementation. We'll get some guidance on that today. We're hearing it a lot about the limited license versus the full license providers. So we're going to touch on that. And then Russell is here providing evidence, policies, procedures, and photos. We're going to go over that today. And really this is, I know that's your evidence. A lot of you have questions of why wasn't my evidence accepted? KDADs, what do you want? Leave me alone. And then of course, Colin is able to be with us today. He's going to go more into detail about the heightened scrutiny guidance. He and I, that on-site visit everybody's concerned about. No, you have not missed it, or the equivalent. As you know, the pandemic is going on, and we're going to do a lot of virtual platforms as we've all learned and are learning all these different Zoom, Teams, Microsoft, all kind of stuff we're learning. And then some important dates to stress for that heightened scrutiny and remediation guidance. And then of course, we're going to always remind you about the additional resources on our website and some additional training and guidance sessions that we're working on that are going to come up. And then of course, we're going to open it up to those questions responding to that. Okay, let's do a quick recap. So the basics of why, we hear this all the time. What is final rule? Why are you bothering me? That's because of this January 16th, 2014 date. That was before my time, but I know a lot of the providers across Kansas, you have been around since that first go around. Colin was here working with KDAD, so he was involved in that going out the first time around. Sorry that things didn't get done. Kansas got behind, but we got a good community connections team. And as you can see, within the last 9 months, 10 months, we have really got the ball rolling and trying to come into compliance so we can continue to get those federal Medicaid dollars coming into the state of Kansas. So that's when it was published and it came out, and CMS let us know this is what you have to do, HCBS providers, to continue to get funding after our date. And then in simple terms, stress in simple terms, we keep coming back to this. When you think about final rule, just keep remembering, final rule is about rights, choices, and guarding against isolation of those persons being served with home and community-based services. So again, we'll stress this. You'll see this in all of our communications, our responses. Hey, what are you doing to ensure those rights, those choices, and guarding against isolation of those persons served receiving HCBS from the greater community? And it's designed, final rule is designed, you know, the purpose of this is the quality of life, increasing the quality of life for our persons served, the services they get, and then the type of settings they're being served in. That's what final rule is all about. And again, somebody did a lawsuit because they felt these rights, these choices, this autonomy, this protections, they weren't in place. So that's why there was a lot of lawsuits, and the federal government and a lot of advocacy agencies said, okay, final rule is going to be the response to that. So that's why we have to do it, and we should do it. It's time for a major change. All right. It's aiming to ensure those persons receiving those long-term services and supports through the HCBS programs, which is KDADs, you know, they're having, again, that full access, those benefits to the greater community surrounding them. So again, as we get to the policies and the procedures, and you know, that may have been why some of your evidence wasn't accepted. KDADs could not, when we reviewed that information, well, not LaTanya, Russell and his team, they weren't able to see how were you plugging in those characteristics and those requirements of home and community-based services in whatever evidence that you had sent in. So we're here today to give you some more guidance on, how can you do that? And then final rule applies to all settings where HCBS services are delivered. And then we'll go in, because there is a way that you can be excluded, you can be presumed compliant, and then we'll go over that later down in the presentation. And then woohoo, because of the pandemic, CMS said, hey, okay, we're going to give you guys an extra year, because the previous deadline for everybody to be in compliance was March 17th of 2022. But because of the pandemic, all of the states were just like, we cannot do this because we can't go out and do site visits, on-site visits in person. Other things aren't being able to get done. Staff's not in the office because we got to do all this social distancing. So they heard us and said, okay, we'll give you guys an extra year. And KDAD's intent is to give that to the providers to work on remediation. Excuse me. And then back to the basics of what. The what is the steps toward compliance that KDAD's and the state of Kansas is working on, because we all feel, and we're going to say it again, we don't want anybody to close down. We're here for you guys. We're figuring out what we can do to help you come into compliance, because we want you to be there, continue to provide services across the state of Kansas, which are needed for our person served. So of course, for you that have been around since the beginning, last September, we got the self-assessment rolled out. Now we're in the remediation process, getting those notifications out. Russell and his team is working hard to get those done by next week to everybody. And that's how we're going to show CMS and the federal government that, hey, Kansas is in compliance. Hey, we're doing what we're supposed to do. And then KDAS can tell CMS to leave us alone, and then we'll leave you providers alone. And then again, stress, we are not out to get you. Remediation and heightened scrutiny is not to close down your setting, but then the remediation and heightened scrutiny is going to be the process that we show compliance before that federal deadline of March 17th, 2023. And then after that, after we get through this first phase, and then you guys were working on all of the technical aspects of that ongoing monitoring, will be the process that we're going to continue to evaluate compliance of those settings. And we're working on getting our assessment. We have to do some modifications and stuff for if you have a new setting or you're a new provider. We're coming back, we're having to process all this first data and get those reports to CMS and say, okay, this was our data for the first round, but then this is what we're doing for those new settings and those new providers. So we will be back to bother people again, because again, just let us know if you're opening up a new setting or you have a close this setting. There you go to the communityconnectionsks.org website, and if you scroll down like you're going to the middle or the bottom of the page, then there is a tab that you can click on, and you can notify us if you're a new provider, if you have a new setting, you've closed a setting, you transition the setting, please let us know that, so then we can go into the system and we can update that data. Okay, clarification. This is something we really want to focus on, because a lot of individuals, providers are having questions about that. So if you are a provider and you own or you can control a day or a residential setting, if you are providing day or residential services, then you are viewed as being an entity. And there is a duty by the state of Kansas, which is KDAD's, we have to assure final rule compliance. So that's why we're bothering you. We request that you take that self-assessment, and then we're going to come back and get those that came in after the assessment closed February the 29th of this year. And then I know a lot of people get confused because some people say settings, some people say sites. So letting you know, when we talk about setting or a site, that's the same thing. And then another one, you'll see the little smiley face. That's a little thought nugget for you, but letting you know a setting can be a physical structure or it's in the broader community. I know when Russell and I were back out, we came out last fall, we had a lot of providers were asking, well, we don't have a physical structure. We don't have a building. We provide all our services in the community. We still have to assess you and figure out what's going on. So if we know if you're presumed compliant, is that truly a community-based services setting, or do we need to figure out what's really going on and figuring out how to get you in compliance with that? So just remembering, we're looking at that physical structure. And if you're one of those that say, hey, we don't have a building, all of our services are provided out in the community, we're still going to be looking, what are you doing? And how we assess that, we're looking for those policies and those procedures, how services are provided out there in the community, because this is about home and community-based services out there. And then, excuse me, looking at that, and then again, if you think you're like, hey, we are presumed compliance, we think we fall into that presumed compliance, make sure you go to the chat, you send that question into the chat, and they are going to get that escalated up to the right desk review team or the review team to look at that, to say, okay, we're going to ask some more questions, go deeper into figuring out what are you doing, you providing evidence of what you're doing in order to get that presumed compliant status. And then you can have that, we send emails, so you can have that. So if we come back and say, well, hey, we don't have your setting in here, you can say, well, look at this, Kate Ads. You said I was presumed compliant. You better get on down the road somewhere. And that's what we'll have. Okay. And then more clarifications. We have these questions on limited license versus full license providers. And this is a trend alert. We get this all the time. Well, I have a limited license. I only serve 1 to 2 people. That's my family members. Hey, Kate Ads, I don't think I should not have to go through the final rule assessment process. And this is our response to you. Your final rule compliance is required of all settings, no matter the number of persons served, the staff, or the volunteers, unless it has been deemed presumed compliance. And then again, you're going to have to go to that website, send that setting in, let us know what provider you are, and go through that process of us saying, okay, yes, you're presumed compliant, or no, we need to get a self-assessment from you. And the state has the duty to assess all those settings, so that's why we're bothering you. Okay. And then presumed compliance in Kansas, again, saying that there are some that were not HCBS providers out there that we know, and CMS let us know, hey, you don't have to bother these entities because they are already presumed compliant. And that is for those financial management services. And that's only if you're an entity and you only provide FMS. If you provide FMS and a day services, then you're going to have to do get assessed for that day service program. If you do FMS and you do residential, then you're going to have to assess that residential setting out there. So there's that. Again, if you got questions, go to the website, ask that question, and we'll get back to you. Okay. And then another example, we've had this question again. Well, hey, again, that's going back to, well, I only serve 1 person and they're in their own private home. So again, we need to know that. We need to go through our checklist of questions to figure out what's going on and dig deeper in, are you actually providing those HCBS services in that person's private home or that relative's private home? We need to assess for that. Any questions? Or Russell, you got anything to add on that? Okay, Russell.
Not at this time.
Okay.
I mean,
okay. That's route for Russell. Make sure
there is a further explanation for the private home, and that I'll address that if we have questions to that.
Okay. Okay, so presumed compliant checklist again, and give it an example because a lot of people, get confused and they're not understanding. So we put in an example of what may be presumed compliant. Again, that's that agency. You're an agency. You only go in to provide maybe personal care services to that person in their own private home. They're out there in the community, and that agency has no ownership or control of that setting. You have nothing to do with the lease, the rental agreement, or anything. They do all that privately. You just go in and provide those personal care services and you're out of there. So that's an example of that. Okay. And then again, stress. If you believe your setting may be presumed compliant, reach out to that community connections team. There's that email we've put out there, or you can send it through the live chat function. Okay. Policies and procedures. So this is Russell. So beat up on him and his team, but policies and procedures. This is a really important slide. Stress. Policy should set the rules of a setting, and procedures should have detailed steps on how those rules of that setting are being implemented by staff, volunteers, and persons served if they have a place in that. So again, Policies set the rules of a setting, and procedures should have detailed steps on how those rules are being implemented. Okay, and then another nugget for you, the community connections team, they're going to look at those policies and those procedures first when they assess compliance for the final rule, for those requirements and those characteristics. Those secondary documents, you guys send them in, they're helpful, but they're going to go first and be looking for what are the policies and procedures of this agency, how do they implement, you know, these requirements, or are they already doing it into their settings? Or, you know, it can be agency wide, it doesn't have to be setting specific, and I'll go over that a little bit more in another slide. But then they're going to look at, okay, handbooks or service agreements or whatever, but policies and procedures, we're going to say it again and again and again. That is like the primary way that we can see what's going on in your setting, in your agency. Policies and procedures, policies and procedures. Okay, attestations. This is something that we're seeing, these trend alerts again, and we're letting you know, giving you guidance. Please, please, please do not submit an attestation as evidence of why a setting does not need to remediate. These documents are going to hit the desk review team. They're going to look at them and they're not going to accept them. And then that's going to delay your process into coming into compliance with remediation. And then a lot of them, I gave some examples down there that we're seeing a lot of that of, you know, agencies are sending in attestations explaining why there are no policies or procedures for a final rule requirement or characteristics, because they're saying, well, the person I serve, they cannot do this, or they will not do this. This doesn't matter, guys. Remember, back to final rule, this is about right, choices, autonomy. So we're looking for those policies and the procedures to saying, hey, at our site, at our setting, this is what happens. This is what happens. These are the rules. This is the guidance. This is how we train staff. This is how we train volunteers. And this is how we educate our person served and our guardians about what their rights, what their choices, what are their options at our settings, okay? And then, you know, I put down there a lot of that. We're seeing the privacy and the rights. Those are the trend alerts that we're seeing, and a lot of reasons of why maybe some of your evidence was not accepted by the desk review team. So, you know, we get it all the time. Having a set of keys to their residence, we get all the time. Somebody will attest to say, well, hey, we can give them keys. Why should we have to give them keys? They're never going to use those keys. That doesn't matter. That you can say, hey, do you know if you live here, you can have keys, your own personal set of keys. That doesn't matter. What we're looking for is those policies and those procedures that say, hey, all residents that live at ABC 123, hey, they have the option, they have the choice to have keys to their personal residence, and we make them aware of that, and we offer that choice. It's okay that every year when you renew and you do that service agreement or residential agreement, you say, hey, LaTanya, do you know you are able to have keys to your home? And they say, no, I don't want keys. That's fine. We're just looking for how was that done? How was that person made aware of that? That kind of thinking. And then access to food is another big trend that we're seeing. Hey, why should I have to have a policy and a rule, procedures on individuals that live here or at this day program? They have access to food when they choose. Well, again, we're looking for, it doesn't matter that you may offer that if they know that they can do with it, but they will never choose to go and open that refrigerator without staff. They will never go and open up that pantry without staff with them. That's okay, but we're looking for those policies and those procedures or that list of rights that you go over with that person served and the guardians to say, hey, do you know if you live here or you go to this day service program, when you want to have a snack, when you want food, when you want this, that you have that choice, you have that right. Those are the type of things that we're looking for. Again, guys, that person must be given the choice, the option, the right, just as anybody not receiving HCBS services or you. You know, put yourself in that situation and say, hey, if I'm in my residence and I want a snack, do I have the choice? Am I aware that I can go get it anytime I want to? Okay. Russell, did you have anything to add on that before I move on?
Yes. Actually, under when you're talking about policies and procedures, so the example is explaining why there are no policies and procedures for a final requirement because someone cannot or will not do anything. Keep in mind, and I know this is kind of a change in our thought process a little bit, this policies and procedures are not about the individuals, it's about the setting. So the setting needs to allow for privacy, needs to allow for those set of keys if that's it. The setting needs to give choice, options, and rights. Where it's supported for the individual will be done in the person-centered support plans. And, but as a whole, the settings need to assure that they're focused on no matter who is there, it's the setting, not the specific individual.
Okay, good point. Thank you. Okay. And then again, this is the trend alerts, going over why. I know you guys are always asking why was my evidence not accepted? Is because when it got to the desk review team, they were unable to decipher how it was being applied, as Russell just said, to the setting. And the examples is also known as, it was too general, you know, in context. They couldn't understand what were the final rule characteristics. You know, how are those rights, those choices, those options being implemented to that setting, okay? All HCBS settings, unless identified again as presumed compliant by the Community Connections team, must have setting-specific documents and activities to demonstrate how it complies with the final rule. So again, policies and procedures, guys, policies and procedures, and they can be agency-based. I know some people are trying to make it specific. Well, why we shouldn't have to have, you know, we have 20 settings, Kate, why do we have to have policies and procedures for each setting? That's not what we're saying. We're saying when we say look at it as specific documents, then that's saying, again, you can make it agency-wide. If you have residential settings or you have several day settings and you're doing the same exact services at all that settings, again, make it an agency policy. And you have the, you know, the policy example, residents of ABC agency will have the choice on what, when, and with whom to have meals. That's an example. When on desk review team, if Russell would let me over there to bother him, but he tells me to stay away. If I were to look at this, I know what type of setting that is. Residents, it's talking about residents. I know this is a residential setting. What are you talking about? Oh, they're talking about meals. So that's when they eat. I can look at that and say the residents of this agency, because this is an agency-wide policy, oh, they have a choice. That's the final rule, requirements and characteristics. They have a choice of what they want to eat, when they want to eat, and who they want to share their meals with. Okay, and that goes back to one of the questions. If you go back to the self-assessment, what was being, those cover several questions of the self-assessment to say, hey, the residents of this agency, no matter what physical location, you know, 123 Sunshine Lane or 123 ABC Lane, all residents, and we train our staff, we keep our guardians and our person served aware. Everybody, the volunteers know when they come into our agency, no matter what setting they're working at, hey, all persons served, all residents that live here, they have the choice of what, when, and with whom to have meals with. And then it's up to the agency. We don't know your settings. It's up to you to figure out, okay, what directions are given to implement that, to make sure that that is final rule compliant. So those type of things, and thinking about that at your setting again, at your setting, how are people served at your settings? Okay, more policies and procedures guidance. Restrictive language, we are starting to see this and getting this, and again, we don't want to close you down. It's just a mindset change, and then us going back and looking at our policies and our procedures that are out there and saying, okay, we have some restrictive language in here. We need to take some of this out because this is completely against final rule compliance. And one of the things, there was a question, I think on the last call, one of the calls, and people were saying, well, LaTanya, hey, there are things that we have to have in place. And guys, it's about, you know, using our best judgment and our common sense and saying, okay, this is going to be a rule. This is a society rule. And, you know, America, we know as we go places, we live places, there are going to be those everyday rules that apply to everyone. It doesn't matter they get HCBS services. It doesn't matter that they don't get. This applies to everyone. And that's some examples in there is when we see that no guns or weapons, illegal drugs on premises, it's okay to have that type of restrictive language. Because again, that's going to be that common sense things for people's safe and welfare, safety of staff, persons served. Hey, nobody should be in here in guns. And I know there was the question, well, maybe it's a private residence, then that's going to be for the agency to say, okay, we've noticed this, talking with that person and their guardian. If a guardian's in the picture, and say, okay, we can't send our person served out here in this private residence because we're seeing some type of illegal activity, or you have a gun laying on the table. Those are the type of things. It's a case-by-case situation that you're going to do what's best for everyone in that. And then a policy example, residents of ABC agency are required to remain on site after 9 p.m. Those are some of the language that we are seeing at KDADS, and that's not going to fly because that is very, very restrictive language on people's rights and choices. And then another one, it was like a resident rule, refrigerators at 123 Lane must be locked at all times. That's restrictive. We're going to be looking more and saying, hey, what's going on? Why is the refrigerators locked all the time and people don't have free access to food? Then that, again, if there's restrictions, again, there can be restrictions in place, but making sure if that's just for one individual or is that for the whole household, why is that a rule from that? But we don't want to see that rule. We want to say, hey, individuals at ABC Lane have access to food at all times unless restrictions are in place, which will be found in the person-centered documents or the person-centered plan. That's the kind of language, that's the kind of thought process we're trying to get you guys to think of unless you're already doing it. And then a procedure example, staff will give permission for residents too. This is something that somebody came to me and was asking questions about, and that is a big no-no. Staff shouldn't be giving residents permissions to do anything. They shouldn't be saying you are required to do this, you must do this. That's the kind of language that if we see in policies and procedures, that's not going to be accepted by the desk review team. And it's going to be rejected, and then try to give you guys some guidance and some say, hey, this may be looking back at what was sent over for evidence the first time and going back and say, oh, there's this word that's in here, or, oh, we need to add this word. That may be why some of your evidence was rejected, okay? Or not, I like to say not accepted, okay? Russell, did you have anything to add on that?
No.
All right, we're good. Thank you, sir. Okay. So more policies and procedures. So remember, I'm stressing. We're going to stress. Your policies and your procedures should show choices, rights, and autonomy, and community integration, but I didn't put that up there, but that's what we're looking for. So again, giving you examples, you guys have been asking for examples. Residents of ABC agency have the right to choose where and from where medical services are provided. So that's showing, hey, we're talking about residents, we're talking about their right to choose where they receive medical services are. They are not required to receive medical services on site. They can if they want to, but hey, they should know, and you should have a policy to say, you don't have to. You can go out in the community, and how can we get you out in the community because you want to go to that doctor, you just moved to this setting or came to this day setting, and you've been using the same doctor for 10 years, and you want to continue to use Dr. Apple out there in the community. Are we going to help you get there, or can family help you get there? That's what we're looking for. And then that's just a procedure example that, you could put in there and say, hey, the medical choice form shall be reviewed and completed during resident service orientation and during the annual resident service renewal. A resident has the right to change their medical provider at any time by requesting assistance from the ABC resident manager if needed. If families doing it, if they're able to do it by themselves, if they're high enough functioning, then you're just letting them know whenever you need help, hey, this is the procedure of how you can get out into the community and get that community integration and express your rights of choice and autonomy and rights, choice, and getting out there in the community. Okay, that's the kind of stuff that we're looking for. All right, Okay, so we're getting people. So that's what's like, stop, hold on, wait a minute. Don't take everything you have and throw it out in the backyard and put gasoline on it and set it on fire. It's like, no, 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 don't lose sleep. I have people, Latanya, I don't know how to write policies, procedures. This stuff hasn't been done in 10 years. We have to go through a long process to get this done. So again, take that self-assessment. Take that table that comes out, that remediation table. Hopefully you've had your notification. What was not accepted by the desk review team? Look at what was sent, what do you have, and stop and say, hey, can we revise this to be final rule compliant? What do we have? Why was this not accepted? You know, can you rephrase the statement? Again, taking out that restrictive language, must, required, you know, that kind of stuff. Can you tweak a few words here and there? Or can you lose a few words there, you know, there and there, and a typo there I didn't catch. But can you do that to say, you know, take out that restrictive language or add, you know, persons have the right to, the choice to, they will, you know, staff, you know, that kind of stuff. What do we need to take out and put in, you know, and say, hey, whatever your process is at your entity to run those policies and procedures through, does it have to go to the board? Does it have to go by person served? You know, what has to go through and say, hey, we need to do this for final rule compliance, okay? And again, stress, stress, stress. Yes, you can use the same policies for multiple settings if those services are the same. Make it an agency policy, like all residents, you know, have choice, right to, privacy to, that kind of stuff, as long as all the same services. And then looking at, you know, I know some providers have like specialized services, then that's where the only place where you would have different policies and procedures. So maybe you have a unit that only serves individuals with Alzheimer's, or you have a medically specialized unit. So everybody that's in this unit or whatever setting you have set up, they are very medically fragile. So you have specialized training, specialized procedures and policies. That would be the only place where we, you know, would see that setting is different, and they might have to have different settings because there might be some restrictions in place for those individuals. As we know, individuals with Alzheimer's, sometimes they like to elope and stuff like that. So that may be where all these locks and alarms are everywhere. And that's what we're going to look at, you know, HEIGHTENED, judgment, common sense. Oh, this is why all these restrictions are in place, because we have individuals at a state in their life where they need a little bit more supervision. So those type of things, guys, that we're going to think about. Okay. All right. Photo guidance. I know this is a big one that hasn't been accepted by the desk review team. And so again, looking at that and say, hey, providers saying, hey, desk review team, why wasn't my stuff accepted? And it's because a lot of it is because the desk review team, when they see it, they aren't able to decipher if the setting was attached to on the grounds of an institution, attached to a treatment center in a gated community. Can they tell if you're operating multiple settings on the same block or location? That may be why. So the response to that and the guidance for this is, you know, the desk review team must be able to evaluate those images and the surrounding business around them or structures around them, especially if it's a large structures next door. You know, sometimes it's another apartment building or something. They need to go into, you guys need to go into Google satellite images or what other platform you're able to use, and just make sure in that immediate area across the street, next door, sitting behind, you know, does the block, do you have multiple duplexes or something that go down the block? And then they're looking at that, well, what's that structure on the end? That might be a school or a grocery store or something that we hope in our rural areas. You know, we're going to be looking at what is that large structure? Oh, that's a apartment complex or something, or a high rise that serves senior citizens. Just make sure you label that on that picture that you send in, and then that's going to help push that evidence through the desk review team. Okay. And then photo, that's another one. The trend alert down there is photo evidence not accepted for locks and on doors. So again, the desk review team is seeking, you know, with this one, they're seeking policies and procedures that describe the process for residents obtaining keys, who has access to keys? You know, what are the expectation of those that have keys? And then that picture that you send in is going to be that secondary document that supports that policy and that procedure, again, saying, hey, all residents that live at ABC 123 Lane, they have the option to have keys to their bedroom door or to the front door if they so choose. That kind of stuff. We're like, oh, that's final rule compliant. And then, hey, here's a picture that shows that person is able to lock that bedroom door. Okay, so that's some kind of guidance we're putting out there for you guys of why maybe your evidence didn't go through. Anything to add on that, Russell, with you guys reviewing all that?
Well said.
All right, thank you, sir. Okay, heightened scrutiny. So this is Colin's baby over here. So the heightened scrutiny, 1 and 2 designations, like he was saying, it doesn't always indicate that changes are needed. Please don't pick up and try to move everybody. Hold on, wait a minute. Let us help you out and figure out what's going on at the location. And can we show that separation of services if you're attached to, I know in a lot of our rural areas that, you know, they reuse nursing homes and stuff, and maybe you have, you know, apartments down here on this wing and the other section has services and the other section has this. Hey, great use of space in our more rural communities, but you see that you're attached to that assisted living or something else down there, or that hospital wing or something else. We see a lot of different settings out there, and it's okay. Utilize that space, guys. We are not here to close you down. So again, heightened scrutiny, you've gotten that category 1 or 2 based on that location or how you answered that question. And then CMS is just saying, hey, you are attached to something you're adjacent to. Hey, we got to take a deeper look at that. And then KDADS has to do an additional heightened scrutiny assessment to determine the level of final rule compliance. It's saying, okay, what do you have in place? Okay, we may need a little extra here to show that you are final rule compliant and that you're going to be okay and that you are not operating with this institution next door, across the street, behind you. So that's what heightened scrutiny is. Nobody's in trouble. It's not a bad thing. We just got to do a little extra work on our end and you guys' end to show CMS it's okay. All right. And then because of the pandemic, putting everybody on notice, we're going to be using those virtual platforms like Zoom. Zoom is the #1 that we see that everybody's using. So we're leaning towards using Zoom to do those virtual visits. And Colin can talk more on that since we're working on those processes of that. Colin, did you want to say anything right now?
Yeah, sure. I might as well just provide a couple highlights. Just for one, as far as just to echo, the category 1 and 2 settings are those that are located in a building that is also publicly or privately operated that provides inpatient institutional treatment, or they're in a building located on the grounds of or immediately adjacent to a public institution. I recognize that most of our IDD providers will fall into the category 3 settings, which those are any other settings that have the effect of isolating individuals receiving Medicaid home and community-based services from the broader community of individuals not receiving HCBS. So the same applies to category 3. Though you may have been flagged as heightened scrutiny, it may not mean you need to change anything. So the other thing to really make a point of is that the on-site or equivalent assessments for heightened scrutiny apply to categories 1 and 2 only at this time. And I believe we're going to get into it more on another slide here. But
yeah, the next slide.
Oh, okay, perfect.
Oh, well, you're fine. You'll be back up.
To that.
Okay.
But so for those that are category 3, it will not require an on-site at this time, because those who are just category 3 can remediate and not require further assessment if all remediation is completed prior to July 1st of 2021. And I'll let the slide continue and then we'll pick up from there.
Okay.
Thank you.
And then, yeah, just the last bullet point right here is letting those category 1 and 2 settings know that additional, we're going to do guidance sessions specifically for you, because I know we have a lot of questions of those that they're under the same umbrella of that larger entity, and they're saying we don't understand how we can separate. How can we show separation? So we're going to have some Q&A guidance sessions for those, if you're one of those that's showing that, and how we can help you out on that. So letting them understand that, the expectations, and then offer that opportunity to have that feedback from and guidance from KDADS. And then we'll let you know those sessions are going to start next month in October. And then those category 1 and 2 setting providers will receive an email invitation invite to let you know to register for when those sessions are going to go. And then Colin, you're back up, as you just talked about, talking about those category 3 settings. Those are, again, we know a lot of the IDD providers are going to fall into that. So again, heightened scrutiny category 3 is those that have the presumed or the potential for community isolation. And again, that's where we look at, do you have multiple sites, multiple settings in one location? So looking at those, maybe you have 5 duplexes going down the street, or you have a campus-like setting where residential, day services, other services are all provided on one location. That's okay. Don't get up, don't close shop. We just need to say, okay, how are you getting individuals out into the community for community integration? Do they have the choice? You know, how do you get them out there? Those are the type of things we're looking at. It's okay to have 5 duplexes on the same block in the same street. It's just, okay, how are they getting out? How are they being involved in social events and those type of things? Okay. And then again, Colin had went over, if he wants to chime in and go back over it again about that 7/1/2021 date, which is coming quickly, guys, for those category 3s. We're looking at, hopefully during the next less than a year, we can get all those settings to prove, hey, we are not isolating. We are not isolating. This is how KDADS, and then those won't have to be pushed on to CMS after that deadline up there. And again, we just need you during remediation for setting 3s, heightened scrutiny settings that fall into the category 3, showing that through remediation, giving that evidence to show how you're overcoming those potential isolating characteristics and getting individuals out into that broader community. And then down there, you'll see the examples of potential isolation. You know, we see people are like, so that gated community, again, those are going to be those policies and those pictures that are showing, hey, we are not in a gated community, or we're in a gated community because that's how the apartment complex is made up. It's like, that's fine. But then again, how do those people get out of that gate into the community? Or they just, you know, have to stay behind that gate all day long, can't ever get out. That's the kind of stuff we don't want to see. You know, near or on duplicate-like services, again, that's where we're seeing the multiple duplexes or townhomes or whatever they're seeing there. It's okay. You don't have to get up and move, or maybe you have multiple single-family houses that are next to each other. That's okay. We're just saying, hey, how do everybody do their own thing when they're in those type of settings, okay? Colin, anything you want to add?
Just so you guys can get the full picture, and we really do think that all settings who are just category 3 have the ability to remediate prior to that date of 7/1/2021. I just wanted to clarify that if the setting does not meet remediation by that date, it's not, the process doesn't end there. It just means that now it'll require a heightened scrutiny assessment. We will be required to put together a summary and then submit that to CMS, letting them know why we believe that the particular setting overcomes the heightened scrutiny presumptions. So by completing remediation before that, it prevents a step not only for us in the heightened scrutiny team, but for the providers you could already be done and presumed compliant prior to that date if all remediation is implemented and confirmed.
Okay. All right. And I think that's going to wrap us up.
And if that's the end, I just had one more thing I wanted to add.
Go ahead.
We recognize that several providers in a lot of settings have triggered heightened scrutiny category 1 or 2, either due to incorrectly answering the question or the evidence submitted, as in the pictures, were not sufficient to be able to determine that it wasn't an institution or next to one. So there is a process the heightened scrutiny team is going through, and we're going to follow up with those providers. Like, for instance, we had a setting that was just a townhome, and it triggered for heightened scrutiny category 1 or 2 because it wasn't apparent by the pictures that it wasn't an institution or something like that. So we'll be following up with those providers via the two-way communication on the website to have those incorrect designations removed. So I have a feeling that there are a few providers that are on that are on this call, and that we will be following up to ensure that we have the correct numbers for all the categories and to remove any designations. So you don't have to worry about an on-site if one isn't required.
Okay, thank you, Colin. And then we're going to wrap this up, and then we'll go into the questions. Okay. So additional resources and guidance, of course, we talked about, we're going to continue our monthly guidance, training, and learning collaboratives. They are starting in October, so just next month, in a couple of weeks. And then we're going to have specific trainings and learning collaboratives on autonomy, privacy, integration, choice, rights, and then as me and Colin will come back out, and we're going to do heightened scrutiny site visits / equivalents as we're using Zoom and all this good stuff. So please be looking, at the Community Connections website, and then we'll also be sending out those alerts for registration for training. Training is going to be given by KDADs, and then the learning collaboratives, that's where you guys come in as peers. We can see what you're doing, sharing ideas, figuring things out, asking more additional questions. But again, we want to help you all get across the finish line for final rule compliance. And then this is how the things we're doing. And again, I'm LaTanya. I'm over all of this. Please reach out to me by email, through chat, or anything. Send it to the CDDO. Mandy and Sherry know how to get a hold to me to say, hey, LaTanya, you guys missed this, or we need more help on this. This is something that I need. And of course, we see it trending. Then we'll put together something to come back out and help you guys with that. And then again, these are additional resources, for that support, the phone number, the live chat, the contact, emails, stakeholder calls. I think one's coming up next week, every third Wednesday of the month from 12 to 1. And then again in the evening, that's what we want you to know. We're there. Please give comments. Please have those questions ready for us, and let the CDDO or KDADs know through that chat function what else, other resources you're going to need. I'm working on a poll, to a survey to get together, because I know we're giving out informations, and then we're putting together stuff that we see providers are having a lot of questions. But hey, again, we're not perfect. We might miss something. We're only human. So I'm going to send out a poll through the CDDOs to say, hey, what do you guys need? What more resources? What more guidance you need? And so the CDDOs can help get that information back over to us, and then we can put together, figure out what direction to go in helping getting that information to you. Also, go out there to our Community Connections KS.org website and look up for that. There's a lot of the remediation. There's our toolbox on there that you can click down if you haven't been on there or you haven't been in a while. Click that down on that. We have a lot of guides up there, FAQs, handbooks and stuff, directions, examples of things. Look on there and see, can you get any of your questions answered, and then utilize that. Please utilize that. And then that is the end of our presentation. Russell and Colin, did you have any last minute things you wanted to go over before we go into questions?
No, we have a couple of questions in chat that I've replied to, so just want everybody to know they're there.
Okay, thank you. And then we will go into questions. I know there were a couple questions that were sent over by the team. Colin, did you guys have those and want to read those off and then respond to those?
Yeah, the first one I'll respond to. I guess the first and the third questions that we got. The first one was asking about foster care and child placing agencies and when they will be notified of their remediation status. We should be able to get everybody notified, to include the child placing agencies, foster care providers, by the end of next week. So that's what we're looking for that. And then just to kind of lead into the question 3 is in regard to clear direction and vague responses. We have done a lot of learning as we've went along in the process, and we have made improvements. So when we get into the remediation phase, you will get very much specific responses on what was good about your evidence and what did not meet compliance for the evidence. So we'll address those a little bit better moving forward, and kind of give you guys an idea of why we needed to do some blanket statements or covered statements. Is just as a reference point, there's 2,800 and some change assessments that have come in. We have addressed over 100,000 questions with evidence to reply back to. So that makes it very difficult for us small staff that we have to be that specific up front. We have found ways to improve our process to be able to do that coming up. So again, this is a learning curve for everyone. We do appreciate your patience and moving forward. So question 2 was Collins. Do you want to address that one? And I'll go to the chat.
Yeah, sure. So question 2 is, I have received notice that my site has heightened scrutiny. What is the time limit that I have to submit more information to Community Connections to address this? So there's a couple answers to this. So if the site was flagged for heightened scrutiny category 1 or 2, there is no time limit to submit more information. Category 1 or 2 settings are required to have an on-site or equivalent assessment. So there's nothing you can submit to the website to overcome a category 1 or category 2 verified designation. But as I described earlier, if it was an incorrect designation, it will be initiated through the two-way communication on the heightened scrutiny tab to get you removed from either that category 1 or category 2 designation. But from what I've seen, a lot of those are still classified as a category 3. So that's the flip side of the coin on this question. If you've received notice that your site has a heightened scrutiny category 3 designation, the time to submit more information to Community Connections to address would be as soon as possible. And the goal would be to have that submitted and remediated prior to the 7/1 of 2021 date, so you could be removed from the category 3.
Okay.
All right. Are there any other questions?
Do you want me to address the ones in chat, or just everybody have the ability to go? Because I know I saw some people that were on the phone.
Yeah, let's go ahead and start with the ones in the chat.
Okay. The first one was, do we still have to send a photo as a secondary, for example, door lock, or will the policy suffice? The response for that is the photo does not need to be submitted, the policy should be able to cover the issue of privacy. You can most definitely submit photos as secondary evidence to help support it. Photographs do also work well to support questions such as gated communities. If you take a picture of your gated community, and for secondary supporting documents for physical access to common areas for residents as a facility. So for instance, if you have someone at your facility in a wheelchair, you have a wheelchair ramp, a photo will go a long way to assist with that as secondary evidence. And then we got another one is, will the slide presentation be made available? I think as LaTonya said, we'll make this available to the CDDO and they can distribute it. So, and we'd be glad to answer any live questions that anybody has.
Yeah, we'll let CDDO, how do you guys do it? You have them put it in chat or you?
Yeah, chat,
Yeah.
or if anybody has any that they just want to,
Ask.
yep, we're good. All right. Well, it doesn't sound like we have any questions. We typically get over it too, but I want to at least touch on this. And since we have Colin on here captive, the guidance released from KDADS, does he have any extra information for us on those?
So, thank you. And yes, I could upload, or I have the link to the KMAP updated bulletin. So just for, in general, the KMAP General Bulletin 20145 is what it is. And let me just, I could go ahead and put it in chat. And I don't know if that's more than you already had or same information that you've, received already. But the main thing about it is, the state approved in collaboration with the MCOs, a process for HCBS providers who have incurred a loss of HCBS revenue due to COVID-19 to apply and be considered for a retainer payment. The purpose of retainer payments is to retain the services and direct caregivers that were previously supporting the participants. And the link I sent there provides some more information as well as different potential forms that would be needed for that. So they're being made particularly for your purposes for IDD residential supports, day supports, and IDD personal care services. I must admit that I'm not the subject matter expert on this the retainer payments. So that's the bulk of the information I have. And that link was very helpful in providing some additional info as far as when the timeline for submissions is and different information like that. And you'd be able to follow up with KMAP for any additional information.
Okay. All right. All right. Well, thank you. Okay. Well, I don't know, Sherry, do you want to go over these last couple of items quickly, or do you want to just send information?
Just real quick.
Okay.
I just wanted to see, I can't see everybody on here. I'm not very good about toggling. I just wanted to check one more time. Is Erin Norris on? We were trying to introduce her. She's the new IDD surveyor with KDAD. So she took Carmen's position, and we've had the ability to meet with her a couple times on some things, and it's really great to have her. So anyway, if you see the name Erin, Aaron, she is our new IDD surveyor in Johnson County. Yeah, I have a couple of things. I don't know which one was on there first, but we rescheduled our TCM provider training for October 6th from 9:30 to noon, and we'll send out the Zoom link in, like next week or the week after, so people have plenty of time to put it on their calendars. And it's not just for TCMs. It does focus a lot on TCM responsibilities, but I think it'd be helpful for anybody. You don't have to be new. You know, you can come back as many times as you want. We'd love to have you. And let's see, remind me what the other thing was, because I don't have it in front of me. I'm so sorry. Oh, transitions, I think. We have actually received into Johnson County through either portabilities or institutional transition folks, and there appears to have not been very good transitions with all entities, meetings and that kind of thing. So we are reviewing that process, and I think we'll send everything out soon. But for people who are porting into Johnson County, either way for licensed services, we're going to mandate transition checklists and ask for minutes of those kind of meetings, just so we can help ensure that the supports that the person needs are being addressed, because we've had significant issues with that. We'd like to ensure that we kind of take a peek at it too. So that's all for me.
Oops, I couldn't get off mute. Sorry, guys. Okay, thank you. Let's see. And that's pretty much it. PPE, again, if you guys need PPE, please let us know. We have masks and a variety of items. And I think that's it for us. Unless anybody has any quick questions or anything like that, we don't want to keep you too long after 2.
Last call for KDADs. Get us while we're here.
Yep.
All right.
We have all these people from KDADs on our affiliate meetings, so.
I can't believe everybody's being so quiet, because they ask us questions all the time.
What's up? Now's your chance. Well, send it to chat. Sometimes people don't like, too many people. We got 60-something people on here. Like, yeah, you don't want to speak up, or put it in the chat box. Yeah. You can do it private. Send it to Mandy private or Sherry private.
Absolutely, for sure.
Yeah.
Thank you guys again, K-Dads.
Yeah, thank you. All right. Hopefully it was helpful.
Well, somebody said Chiefs. I didn't see that in the final rule. I'm not sure what that refers to. So yeah, we are done. Please let us know if you need anything, and keep up the good work, and we will be in contact. Our next affiliate meeting is Thursday, October 8th. So we will talk again then.
Thank you.
Thank you, everyone. Thank you, KDADs, very much.
Bye-bye.
Thank you.